Yeah, I ain't gonna say that. Listen, I'm morning class and I'm stuck in night class, so I can catch up. So, what I want you to know, and I want you to understand, no matter how many times you may go MIA on us, and you may feel like your work is piling up, there is work that is due to be turned in. Communication. Let us know what's going on. We will help you get caught up. Getting caught up. Show us that you actually comprehend and know how to create these things. So that means you might get a whole different project, but it gets you caught up. We, as your professors, have the power to help your grades come up, to help you achieve and actually understand. That's what we signed up for. So we can't serve purpose if you don't let us.
We've got some attendees joining, so just want to welcome everybody, and we're just waiting on one more person, and we'll get this thing started.
Matter of fact, let's go to the lab. So I can show you what you're gonna download on your phone. And it's $10,000 a month for it. Okay. Come on.
Hey, Tropikana.
Hi, John. Can you see me?
Yes.
Okay. I am turning my background off, and I am ready to start when you guys are ready to start. I am going to be transitioning from inside the car into my classroom at the same time, but I am here and checking in. You guys are ready.
I'm going to go ahead and start us on Facebook, and then you can get us started. Dr. Edgy is here, and Tasha is here as well.
Thank you.
Give me just a few seconds, and we'll get this started. And we are live.
Right. Hello and welcome to another edition of the Center for Closing the Health Gaps Town Hall meeting. Today we are going to be talking about what do we need to know to protect our family and loved ones this summer. I will be your moderator for the evening, Tropikana from 101.1 The Wiz, and I have some really wonderful women joining me this evening to talk to you more about what you know. The first guest that we have is a very esteemed medical expert, one of my favorite doctors in the city, Dr. Lou Edgy. Good evening, Dr. Edgy.
Hey there, Tropikana. How are you?
I am doing wonderful. How are you?
I'm doing fabulous. I start that way, and you got to knock me down pretty hard through the day to get me away from there. So
I know that's right. So excited to be talking to you as things have begun to change with COVID. We have been seeing a lot of rise in spikes. So what information after what we also have a community member joining us as well, Tasha Wilkinson, who is a mother and a student and a working mom and wife. Hi, Tasha. How are you? I believe Tasha's in class right now. Okay. Well, Tasha is able to check in with us. We will switch back over to her. I don't know if she can hear us.
Oh, can you hear me? Can you hear me?
Yourself.
Yes, we can hear you now.
Okay, I'm sorry.
Yes.
I'm doing okay.
Tasha, thank you for tonight's town hall meeting. Now, Dr. Edgy, over the last couple of weeks, we heard
Tropikana,
that there are. You can't hear me?
I can hear you now.
Okay. Dr. Edgy, we have heard a lot about the numbers rising with COVID-19 the last couple of weeks, and a lot of parents and my listeners have been wondering, what do we do when the rest of the world has kind of forgotten about COVID? We're not talking about it anymore. How can we protect our loved ones, our children, as they are gathering? Football season is starting, parents are back outside with their kids, and the holidays are around the corner. What do we need to know?
So a lot of the tactics that we use to get us through the December surge in 2020 are useful things to do now. And so that would be keeping a surgical grade mask. So one of the hospital grade masks and N95s with you. If you're going to be in an indoor location for sure, that would include things like going grocery shopping and so on, gathering in homes. I would still go ahead and make sure that you do have masks. And if you're going to have you mentioned a gathering for a holiday or whatever, to really go ahead and make sure that folks are actually testing prior to gathering. I'll give you one example. I just came back from 2 weeks of business related stuff. You know, a lot of our medical meetings are starting to go in person. And so I guess you'd call it a medical senator from Ohio. The AMA has senators, the American Medical Association has doctors who are elected from each state and each specialty society, and we meet twice a year. So our meeting came up in Chicago, and that's 2,000 doctors in one place. And the question is, how do you keep us all safe when Omicron, BA4 and 5 tend to be as contagious as measles? So what they had us do is we tested, all of us had to test prior to coming to the meeting. And they had to have us test 72 hours into the meeting as well. And most of us tested when we left, just to make sure that we were safe. So number one, making sure you've got good masks, not cloth masks. And number two, that you're having testing kits available so that prior to being involved with a crowd and afterwards, that you have some way of keeping track of whether there's a problem or not. I think we lost Tropikana.
Okay. As we are transitioning from the into the classroom, Dr. Edgy, I am still here. And joining Tasha in studio in the classroom, you were sharing different tips that we should be doing in order to protect ourselves this summer. Now, one of the questions that I wanted to ask you, and I know that Tasha also has some questions as well as a mother, with our kids going back in to the summer months and those numbers rising, as you said, people need to start wearing masks again. But how do we get them to take it serious again because they don't think that it is still in existence?
So Omicron BA 4 and 5 are as contagious as measles, and so we have to set the example. I make sure that I've got a stash of masks in my bag so that they're immediately available. And if I'm going to be in any confined space, I'm going to be wearing a surgical mask. As I was saying, we have this huge meeting that I just came from in Chicago with about 2,000 doctors. It's our first in-person meeting, and for that many people to be in one place, we really had to make sure we were protecting ourselves. So in addition to having masking and socially distancing best you can, one of the things that we definitely recommend is having easy access to testing, which we'd not had previously back in December. It was just a harder thing to do. So we had to test at the beginning of the meeting. We were in the hotel. We were not actually able to enter into any of our meeting rooms until we had tested negative. And also 72 hours into our 6-day meeting, we had to test again. Most of it's test on the way out. So having easy access, keeping a testing kit available in your home, as many as you need for your family members, I think is something that you want to have and anticipate, and keeping your masks available as well. And that's not to talk about all of the other options regarding vaccines that should be used in the first place as well. So we'll talk a little bit, I think, down the line about vaccinating our 5 through 6 months kids as well, to try and help that we round out the protection for the families.
Now, Dr. Edgy, you said that the new variants are as contagious as the measles. What are some of the things that we should be looking at? Because I understand that COVID changes as the strands have changed. What are some of the telltale signs that we should be looking for to see if maybe we have contracted it?
Well, this is actually a difficult thing, right? Because a lot of people have allergies and they have other things that are also kind of happening at the same time. So if you have an unexplained, set of symptoms that are just things that are not normal part of your seasonal exposure, then I would go ahead and make sure you test. It's better to test if you're not sure than to go ahead and assume that you're doing okay.
Dr. Edgy, I have been speaking with people recently. As a matter of fact, I have a family member that I was speaking to just a few moments ago who has been experiencing severe chest pains, and they've had a cough that's unexplained that they can't get rid of. I was sharing with them that it's so important that you go get a COVID test. Literally have been arguing this point, but they feel like they shouldn't have to test if they've been vaccinated because they should be safe from the new variant. Can you kind of speak to that?
No, absolutely not. In fact, we've done our little mini test here with, in Chicago, and all these doctors were together from across the country, where all of us had to be vaccinated and boosted and no symptoms to get into the meeting. And we had to have a negative test. And still we had a couple who came back positive after we've come back home from the meeting. So the issue is that even if you're vaccinated, the Omicron variants, the latest ones are actually able to work around some of our immunity. So again, I think this is another push to get your entire set of family members vaccinated, including those for Moderna, 6 months to 4 years, and for Pfizer, or for Moderna, 6 months to 5, and then for Pfizer, 6 months to 4.
Now, I want to talk more about getting the babies vaccinated, but you just said something that was a bit scary. And you do this every time. You say something that scares me just a little bit, makes me on everybody else. And I appreciate it though. But you said that the new variants have an ability to kind of work around our immunity. Can you kind of speak more into that? And can you share will we be looking at possibly having to get another vaccine?
It's possible. it is very possible that that could happen. As you know, that the variants are unpredictable, and this Omicron set has sort of had its own increased infectivity. So it is much more likely to be able to be transmitted from one person to the next than the Delta and some of the other ones that we had in the past. And then also we have had some breakthroughs with folks as well. So of course the infections that are coming through are not as significant unless there's been an underlying health condition that's going on already. And even then we've got milder cases, fewer patients as far as being admitted, even though the numbers are continuing to climb.
Now, I have some more questions, but I'm going to turn this over to Tasha, who would like to ask you some questions as well. So I'm going to let her ask a question. Tasha, what are your thoughts?
Well, my question is, okay, so I have a 6-year-old son that, you know, of course, when he puts on a mask, he'll put it down and stuff like that. How would I get him to like wear it, you know, all day, like when he's in school and, you know, so he can, because he's vaccinated, but another question, will he be able to get the booster as well?
So as far as kids and boosters, right now, I don't have information on that in combination with the fact that he's 6 years old. So that's something that, when was his shot? How long ago was his?
He got it in November.
Okay. All right. So it's been a fair bit of a while. As far as the masking goes, yours is as good as mine as far as a guess on how to get a kid to wear a mask. There is no magic answer to that from a doctor, except to say, do it by example, and, you know, wear your mask, keep one handy, because, you know, kids not only take them off, but they can lose them. Mm-hmm. So have a backup plan for them as well. Strict hand washing, try and maintain distance. And again, anyone who's under 6 and has not been vaccinated, absolutely go ahead and get vaccinated. On the issue of vaccines, I think so you have the Moderna vaccine for age 6 months all the way up through age 5. And they are actually 2 shots, and they are a quarter of the adult dose. So higher dose than the Pfizer vaccine. They are 1 month apart. The Pfizer vaccine is 3 shots, but it's much smaller. It's 1/10 of the adult dose. That's why you have to have 3. And you have 1, and then 21 days later, you have the second one. And then at least 8 weeks later, you have the third one. And the way Pfizer had actually decided to handle this was try the lower doses, and they wanted to make sure that people were not having as much of a reaction, that their parents would be much more likely to have their kids do additional shots if there was less reaction. Moderna took a different approach, like I said. So Moderna is a quarter of the adult strength instead of 1/10 of the adult strength. But you only have 2. You may get a little bit more reaction. It's called a little bit more reactogenic. Potential side effects, nausea and vomiting in 1 in 10 people. And then you may have, you know, some injection site soreness in some of the others as well.
Okay.
Now, Dr. Edgy, you mentioned that we are now in a position where we are able to get children 5 and under vaccinated. Now, I guess my question would be, along with getting them vaccinated, we are definitely wanting them to wear masks and to wash their hands. What else can we do to kind of encourage parents to get their kids vaccinated? A lot of people are still in a lot of fear from the vaccine. I know that we've gone over this 100 times, but what can we say to parents to encourage them to let their younger babies, who are a little bit more, I guess, dear to your heart, how do we encourage them to get their babies vaccinated?
Let them know that they should continue with doing their vaccines like they normally would. And specifically, a lot of these parents, if they've got young kids, have already got their kids going through vaccines from birth. In fact, you know, hepatitis vaccines starting very, very early. And so this is not a new thing. Parents get their kids vaccinated on day 0. I mean, they're right there getting those children vaccinated. I think encouraging them about the safety of the vaccines, they continue to be safe. There's nothing that's changed in that arena. And I think it's putting aside some of the noise that has come into play from politics and religion and other things. The science is solid, and it's as solid as it has been, and even more solid in some situations than some of the other vaccines that we have been giving to kids and mandating for kids to get into schools with.
Awesome. Now, I would not have imagined that a year and a half later, I would still be arguing in classrooms. And hint, hint, I'm in a classroom now. I'm not going to call any names. I would not imagine that a year and a half after us doing all of these town halls and all of the research, that we would still have people who would argue the point of the vaccine isn't safe. I literally had this conversation last week. I just feel like there is something going on with that vaccine because they are telling us that we got to get it. There's got to be something wrong with it. As many times as you have repeated this, for those first time people who are tuning in with us and people in the classroom, can you speak to the efficiency of the vaccine and the safety of it?
Yeah. So the efficacy of the Moderna vaccine, I just remember having a smile on my face under my mask. Back when we found out that the efficacy or the effectiveness of the Moderna vaccine was 94.5%. That is unbelievably high. And so it's effective, but then also the safety profile was excellent as well. This was not affecting pregnant women. This was not going to affect newborn babies. This was not going to affect, essentially, anyone except for our patients who had, our adolescent men. We had a small number who did end up having issues with inflammation of the heart muscle. Beyond that, we have really had a great clean profile with our mRNA vaccines. So, again, safe and effective. You really can't ask for much more than that in a vaccine.
Absolutely. And I just think that when we have these conversations and the fact that it's, been this amount of time, when we look at the numbers versus the people who have had fatalities from COVID versus the people who have experienced a negative reaction to the vaccine, the majority of those people, from my understanding, were people with underlying symptoms. Can you kind of speak to that? The vaccine versus the actual people who may have had a bad occurrence with it.
Yeah, very, very small. And in fact, I look back to 6 weeks ago, we just passed the 1 million mark on folks who passed on, right, from COVID. 1 million Americans.
1 million Americans, Dr.
Yes, yes. So that is a huge number. And, we found that folks who are not vaccinated are much more likely to go ahead and end up being in the hospital, being sick, passing on from COVID. Those numbers are still, when you look at the folks who are having significant issues with COVID itself, that is what we're seeing as far as numbers. So these vaccines are saving lives. I cannot even imagine how much higher that 1 million number would have been had we not had the vaccines, because it has just tapered down across the board as far as deaths of individuals that we're having from COVID. As far as the vaccine safety, again, we had that blip where, we had some concerns about blood clots with J&J. And again, very, very tiny cohort of women in a small age group. But the risk of having that was actually higher from not having the shot than having the shot. So,
Dr. Edgier, you said that we have passed the 1 million mark when it comes to people who have passed on from COVID. Are we still seeing a lot of people being hospitalized from the new variants?
Not as many. So the problem, though, is milder disease, but we have about a third of people who are actually having symptoms of long COVID, which would mean that they've got lasting effects, that are going beyond 3 months, fatigue, foggy brain. These are some complaints that patients come to the table with. I can't concentrate the way I used to, and so on. So even mild cases of COVID can have lasting effects that can affect your ability to function the way you did at your previous time. Just having the energy to do some of the things that you would normally do, walking, etc., endurance being off, can affect folks. So I think it's very important for individuals to realize that it's not like getting a cold and getting over it. You have a potential, and you're sort of rolling the dice, when you get it, as to whether you're going to be somebody who does have some of those lasting effects or not.
Wow. Now, Dr. Edgy, is there any relation to how long you wait to get the vaccine to how long those symptoms may last? You speak about the brain fog, and you talk about the fatigue and how COVID does a number on your body. Is there any research, I'm curious to know, of people who maybe waited a long time before they got the vaccine and they got a different variant, or if they had it and they weren't vaccinated? Are we seeing any research about how COVID is affecting those who waited a long time to get the vaccine?
No, I don't have numbers on that. Just looking at any of the research, again, it's back to, for those who did get COVID, how many of those end up having long COVID? There's not a period of time where you wait and then you see whether you get long COVID without having the vaccine. I don't have any numbers that I've been able to find on that particular issue.
Wow. Now, Dr. Edgy, you also mentioned that as we're going into the summer months, we need to go back to the drawing board of how we originally protected ourselves with COVID. You talked about we talked about social distancing, we talked about wearing masks, we talked about washing your hands and singing the songs and all of those things.
Right.
Should we still be thinking about social distancing when we put our kids in sports or when we are going outdoor to concerts? There are no restrictions any longer for being vaccinated, showing your vaccine card, or having to wear a mask.
No, I still
Yes.
keep distance. Even when I'm in the stores, I stand far back away from people.
Yeah, I think the masking thing is probably the most important of the bunch. It's going to be very difficult to do the social distancing, but where you can, I certainly recommend not clustering indoors as much as you can. We actually over at UC are trying to make sure that unless a meeting has to be in person, that it's actually virtual. There are other events that we have, again, where we are required to be vaccinated as healthcare providers anyway. So our environment is a little different, but we also are ones who are taking care of patients who haven't been vaccinated at all. So we are surrounded by some of that. Again, when I go to the grocery store, I've got my mask on because I have no idea who else is walking in that store with me. And I certainly don't want to have to take time out, because I got an exposure. And again, this is exposure for folks who are actually, already vaccinated and boosted. You can still get some COVID. Is much less likely to happen, but with some of these Omicron, the later, more recent variants, that's certainly it. Now, Moderna did just actually announce that they, over this past weekend, that they have another vaccine that an additional vaccine that's out that is actually targeting some of the initial variant, but then also specifically BA4 and BA5. There's a question about, well, how is that going to help in the long run? How often will we end up needing to have boosters? We don't have the answers to all of that at this point in time, but they've been trying to make sort of designer vaccines to try and target the more agile variants. Like,
wow. You said we don't have research to see what that looks like, but from just what you've seen so far with COVID over the last 2 years, do you personally believe that we will continue to have boosters or some level of vaccine for a while now?
Yeah, I do expect so. It's probably going to taper down, but we are not even into the winter months. So we will probably have another surge, and depending, Omicron, we couldn't foresee that. When we were in the middle of Delta, we're like, this may be the worst it could be. But we still have winter to come where everyone's, again, going to be back indoors. We'll also have, the addition of the flu as a potential confounder as well. So, again, we've got treatment as well, which is new, relatively new as compared to, in the beginning of the pandemic. So we've got Paxlovid, which is something that has been helpful as well. So we've got a lot more tools at the ready available to help us than we had in the past. And I'm grateful for that. There are also a couple other vaccines, Novavax and so forth, they have a different way that they are made than the mRNA vaccines of Pfizer and Moderna. And those are just approved now for, for EUA. So the EUAs were approved by the FDA. So some of the vaccines that have been used overseas are now options as well.
How close are we to herd immunity? Do you think that it is still a possibility to even achieve it at this point, with people still being steadfast, and not a big group, but the small group of people who are still fighting against the vaccine, whether it's politics, religion, or just their own conspiracy theories? Are we close to it, and is it achievable?
We're closer, but we're probably not going to get all the way there, just because the nature of the hesitation for the folks who've decided they're not going to do it. Kaiser Family Foundation data actually, which is a think tank that actually goes ahead and does surveys of people's thoughts about COVID and things like that I've been following all the way through the pandemic. That is a great source of information, and they are still very, the data is showing that people who are not vaccinated are actually even more sure that they're not going to be getting their vaccine. So they are actually being emboldened, you know, and strengthened in their stance as time goes by. Since things have been getting milder with respect to, you know, the diseases or the presentation of COVID after a patient's been vaccinated. So that's unfortunate, but I think there's going to be a place where there's a group of folks who will never be able to reach.
Wow, that is unfortunate and sad to hear.
Yes.
For the people that we can reach, we do what we can, and we try our best to continue to keep people educated. Tasha, you had another question for Dr. Edgy?
Yeah. I had the Moderna vaccine and a booster.
Great.
I have underlying conditions.
Yeah.
So God forbid that I come down with it. Will it still affect me worse because I have the underlying conditions?
It's possible, but it certainly would not be as bad as if you had not been vaccinated at all. You've done all the right things to go ahead and get vaccinated, getting your booster, you know, paying very close attention to your symptoms. If you have symptoms, making sure you're testing early, making sure that if you're going into an environment where you think you may be at risk of getting exposed, that folks in that environment are testing. So for example, you know, we have 4th of July that's coming up. Luckily, that's an outdoor type holiday for most people. But, you know, there are folks who will say, if you're going to be coming over to celebrate 4th of July with me, well, we want to make sure that everyone's been tested. And that's a legitimate things. So, you know, for us to actually ask of our guests.
Okay. Also, God.
Okay, well, while you figure out that train of thought, I do have another question for children under 5 who are now able to get vaccinated. You know my question about Boogie. How do we look at our kids with underlying symptoms? Should we still take them to go get vaccinated?
Absolutely. It's always a good idea to have a discussion with your doctor, your personal doctor, Boogie's personal doctor, if you are unclear about something, but there are very few contraindications, as in reasons why kids cannot get vaccinated. In fact, the most vulnerable amongst us are the ones that actually need the most protection from COVID. And so for that reason, there's really no reason not to go ahead and step forward and get your kids vaccinated. If my 24-year-old Francesca was his age, she would be in line and already getting vaccinated and would have gotten her first shot if she could, if it was yet available. And they're meant to be available by the end of this week. But absolutely. And actually Hamilton County, does have, a no shot, no appointment, totally free opportunity for folks to go ahead and actually get their vaccine. So Hamilton County Health, Public Health.org, you can go online and get that information.
And also, thank you to the Health Gap providing this resource for us to get this information and to connect with you, Dr. Edgy. You can also log on to COVID-19 community resources as well to find all of the testing sites, all of the places where the vaccine is available. I just think that it is awesome that we are able to access you. So one, I just want to tell you thank you, because Dr. Edgy, this has been Town Hall 137. I'm
Oh my
probably
goodness.
right. No, it's probably not, but it seems as though.
No, it's not.
Thanks,
Well,
Renee.
But I will give you a fact though. This is Moderna trial day 642 for me. So 642 days ago, I was like, you know what? I've read enough about Moderna. I mean, you know, this unknown vaccine and mRNA technology that I feel like we can move forward, Lou, and enroll in this trial and hopefully be part of the solution, because people were dying we had nothing except make sure you wash your hands, wear your mask, and socially distance, and no vaccines. And it was just a really scary space to be in. And I was just so grateful that, you know, they've been as successful, as safe, as effective as they have been.
We have some questions from our listeners and our viewers on Facebook. Thank you guys for chiming in. We have a question that says, Dr. Edgy, how many booster shots do we need to take to stop getting tested? Are the side effects or the possible side effects, what are the side effects when it comes to vaccinating our youth and our babies?
Yeah, so that's a great question. So right now, for folks who are over age 50, and have underlying conditions, definitely you want to go ahead and get to your second booster. So, you know, 2 Moderna, 2 Pfizer, plus your additional boosters. For those who are under 50, you definitely should be getting, you know, your initial shots if you've not already gotten those, and get your first booster for sure. And for the kids, definitely getting 2 Modernas, 1 month apart. Again, higher doses than the Pfizer, which is 3 shots, 21 days apart for the 1 and 2, and at least 8 weeks between dose 2 and dose 3. So I think those are the most important things. So as far as side effects, because the Moderna vaccine for the kids 5 and under is actually a larger dose, it's a quarter of the adult dose, we expect that to be more reactogenic. So much more likely that you may have some side effects, but it's only 2 shots instead of 3. And the side effects that we expect, 1 out of 10 people will have nausea. 1 out of 10 kids will have nausea and vomiting, injection site soreness, maybe a little fever, maybe some muscle aches. For Pfizer, much less likely to have those symptoms. But, you know, as with any vaccine, injection site soreness, and, you know, again, that'll be a 3rd shot. So a 3rd time in for the kids. Sometimes it's hard to get them in for the 3rd shot. The 3rd shot is not optional. You will not get the immunity you expect or need if you are going to go ahead and skip that 3rd shot for Pfizer. You need the 3rd shot for it to do its job.
As we are going to answer some more of the questions that are chiming in on Facebook, I do have a question from a parent that was submitted earlier today. They wanted to know if they got their child vaccinated, but they did not follow up to go get the 2nd shot when it was originally scheduled. Do they have to start the whole process over again, or what should they do if they miss their date? I guess that would apply for adults as well.
Right. So it really depends on how long it's been. I would go ahead and definitely not scrap that. Most likely they will need to go ahead and start the series again, but it will really depend on how long it's been since the last shot that they got.
The questions are coming in rapidly, so I want to make sure that we get to some of these. We have a question that says, what are the statistics of deaths caused by the vaccination?
So extremely low, right? So we have really had nothing that we have been able to attribute directly to the vaccines. The issue that we do have a lot of data on, as I mentioned before, is just within the United States, 1 million deaths from COVID, okay? And There was one study that showed that there was a huge number of deaths that we would have had in addition to that had we not had the vaccine. And if the people who are vaccine hesitant have gotten vaccinated. So, you know, again, getting vaccinated is your primary goal. I think that's extremely important. We have had the complications of myositis, and so muscle inflammation of the heart for a small cohort of men, adolescent men, and then blood clot with J&J in some women who are of childbearing age. Again, very, very small numbers, and none that would be higher than the numbers that you'd see in the regular population. And so again, safe and effective. And we always have to think about, you know, what are the numbers of folks who are not even related to, who didn't get the vaccine, what would the numbers of those conditions be in that group of people? And when they are less in the vaccinated group, that's something very important to note.
These questions are a bit aggressive. I'm going to ask them though, because if you submit them, I'm going to ask the question. If the vaccine doesn't prevent you from getting COVID, why the hell should people get the vaccine?
Yeah, so it does prevent people from getting COVID, except we have variants that mutate. And so, as we've said before, the variants tend to circulate and mutate in unvaccinated groups of people. And so the more the variant's out, the more virulent or the more likely it can be to be something that's contagious to an individual. We've had an escalation, as you saw, from the British variant that came out, and then the Delta, and then Omicron. They've gotten a little bit more sophisticated, these variants, as they've gone out. Our job with vaccination is to try and decrease the pool of people in which that virus can start to change itself and get smarter, per se, and evade certain things. So yes, there are some breakthroughs with individuals. We know that you're less likely to have death or serious COVID from a situation if you do have a breakthrough. So again, I understand your point, your question. The reason to get vaccinated is to keep your symptoms and your ability to get into the hospital down if you do get it. And number two, to make sure that we're not having a pool of unvaccinated people that are basically a culture breeding ground for variants to start to change and become smarter as we go.
Now, for people who have already received the vaccine and their booster, we still can contract COVID and pass it. So in order to be responsible for our peers and the people around us, what can we do to protect others?
Again, I would be liberal with your testing. So have test kits available. I traveled, like I said, to a huge meeting with 2,000 other doctors, plus their spouses and everything else. I had a COVID testing kit. When I got to the hotel, I had to test. I tested 72 hours into the meeting. I had a testing COVID kit in my backpack ready to go as well, so that, you know, if I have any symptoms, I don't have to kind of run out to the store and figure this out, get one, potentially expose people. Have some stuff in your home, have yourself ready to do that. And if you test positive, even if it's a faint little line on your test, that is a positive test. So you got a C, which is the control. That should always have a line on the test. And then you have a T, which is the test, your actual COVID response. And if you even see a faint line, do not ignore that. That is a positive test. Do what you need to do, you know, and let the folks that you've been exposed to, who've been exposed to you, know. If you have to be off work, you have to be off work. That's one other practical thing I do want to mention about the vaccine is that, you know, if you have had an exposure and you're actually vaccinated, you're much less likely to have to do things like, you know, leaving work and so on and so forth, taking time off so that kids can be home from school and so forth.
Absolutely. Dr. Edgy, after I'm going to return back to our questions on Facebook, but if you were to contract COVID, things have changed so much since the original, you got to be out for 14 days, you need to sit down, stay away from people. What should people be doing if they are vaccinated or not, and they contract COVID? What should you be doing to protect the rest of the community, and how long are you out after?
Yeah, it's been 5 days. And so I'm going by our guidelines at UC Health. So if you've got an exposure and you're symptomatic, then you're going to go ahead and test. That's definitely an absolute. But if you've gotten a full exposure and you know this and you have not, you've not got any symptoms at all, you really should be out for 5 days.
Okay. Returning back to our guests on Facebook that are chiming in. Someone asked, what is the number of population in the country of people with preconditions and how the numbers determine? I'm not quite sure if I understand that question.
So are you asking like how many asthmatics? That's a tough question because there are multiple different conditions that actually are health conditions that predispose you and put you at risk. So I think the important thing is to know that if you have an underlying health condition like diabetes, like asthma, like sickle cell disease, those are things that actually can make your situation worse if you do get COVID. You're much more likely to be sicker, much more likely to need to be in the hospital, et cetera. And so also being over age 50 puts you into that category as well, even if you're healthy, and I'm 53 this year. So for me, booster is where it's at, and this will be second booster for me.
We have another question submitted that says, so what are the statistics of individuals getting blood clots due to the vaccination?
So I've not actually heard any blood clots recently. The J&J vaccine, which I think has just really sort of dropped off the face. I haven't heard a lot about that, but again, recently. But about a year ago, when J&J was really sort of the main thing that people were like, okay, I only have to do one shot. We started to hear about adolescent men, again, very tiny numbers for myocarditis, and which basically, again, is inflammation of the heart muscle. And again, as far as blood clots, that, again, smaller numbers than if you get a blood clot with COVID. COVID itself is a clot forming mechanism. And so your risk of getting a blood clot is 16 times higher with COVID than it is with any sort of exposure to any vaccine, including J&J.
We have another question submitted by someone on Facebook that says, have we researched into the mass shootings compared to the coronavirus deaths? Or, and I guess my question would be, could we say that maybe the stress from COVID is maybe possibly causing that? The mental?
I'm a medical doctor. All I can tell you about gun violence is that at the meeting that I was at, that I just mentioned, the AMA meeting, we have determined at that meeting that gun violence is a public health issue. That means that I'm one who is in resident education. So once a physician comes out of medical school and they're learning within their specialty, it is our lane, although we're like, a lot of people are like, get out of your lane, get back into medicine. It is in our lane. If somebody has a gunshot wound to their liver and we are in the surgical area teaching them how to sew that area of the liver that was damaged, if they get shot with a particular weapon and instead of just making a hole in the liver, it turns that liver into liquid, there's nothing to sew up. So this is our lane. And so we've altered how we teach people how to do certain things based on the episodes of gun violence and the guns that are being used. So again, it does fall into our lane because patients show up after these events, if they have lived through the event, in our emergency rooms, and our residents and fellow doctors in training have to understand and learn how to handle these patients. So beyond that, I'm not an expert in any of those items. I'm not a gun violence expert, but as a physician, we are the recipient and we're called to save lives. So.
Dr. Edgy, now this question is a bit off topic, but kind of not, as we are talking about mass shootings and that being a public health crisis and that now being a part of your lane. On top of over 600 days in the Moderna trials in researching COVID, how do you How do you maintain a place of peace and mental health for yourself with all of the things that you see on a day-to-day basis?
Yeah, so I have always been involved in policy making. I think that's one of the most effective ways to make change in our environment. And so, as I mentioned, the American Medical Association is sort of like a doctor's congress. Every specialty has senators, every state has senators, every branch of the military has senators, and you have to be elected from your state to participate and to vote in these positions. And what we do then is we meet twice a year and discuss policy and, for example, obesity as a disease. When we, back in 2017, said that obesity is a disease, now all of a sudden doctors could go ahead and talk to patients about it and go ahead and actually have that be a diagnosis that they could put on the chart and get coverage for insurance for all of the things that benefit their patients. So I go to these and I represent Ohio because we are having everyone sitting at the table, FDA, CDC, all of these different branches of the military as well, able, when we're making decisions, they're at the microphone and they're able to chime in and say, yes, this is something that can go forward. And then we're able to go ahead and assign dollars to certain things that we think are important. So
That's where you find your balance.
where I find my peace. But you know what? There are other things. I love watching movies. So I make sure I keep up with my shows and schedule time in. I do calligraphy. I think you just have to find things where you're completely turning left or turning right out of the lane of where you work. There is actually a great study out of JAMA Network. It basically says if you spend 20% of your time doing something that is meaningful to you, it decreases your chance of having burnout. So you can get peace from that. And if that is your faith, if that's something else, that is something that's substantive. For me, that is really important. So I make sure 20% of my time, however you slice it, is spent doing something I really, really find meaningful.
And I asked that question because it can be a bit overwhelming, which would cause that COVID-19 fatigue of, I'm not even thinking about COVID anymore, so don't ask me about getting vaccinated.
Sure.
I'm not wearing a mask. I want my regular life back. Y'all are shooting up the schools and everywhere. There's nothing I can control. And that can be a bit overwhelming. So
Absolutely.
I ask that question just for people who do feel a bit fatigued with having these conversations that are absolutely necessary.
Yeah, and the doctors are tired. The doctors are tired. Yeah, it's been, we have learners who only have known COVID in their after medical school training. So it's very important that we take time and manage our mental health as well. That's just as important as the physical.
Dr. Edgy, I can't tell you thank you enough for your service and your dedication of being on the front line, literally, and then still taking time, no matter how many times it takes or how many times we have to say, wash your hands and put your mask on in 2 years. Thank you for still having the same excitement and dedication to the community, because there's no way that I could argue with them and say, well, Dr. Edgy said, because I'm an expert, because Dr. Edgy said I couldn't do this without you. None of us could. So thank you for your service, and thank you for asking these questions. And no matter how repetitive it has been, thank you for still showing that level of compassion and empathy for those who want to learn.
Absolutely. And I'm happy to do it. And I appreciate that you have a forum where people can come back, and over time, hopefully we can help answer their questions and bring them closer to doing what is the right thing for them and their families.
So thankful for the Center for Closing the Health Gap. Tasha, you wanted to ask one question before we wrapped?
Yeah, I just wanted to ask about, do you get therapy, or does the other doctor get therapy? Because, seeing that
on a day-to-day basis.
Yeah, is sick people, it's it would be oh my gosh, I can't deal with this. So
yeah, so on the issue of physician mental health, we think of our medical school, a medical school class is usually about 400 or so people. when I was in medical school. They've gone down to about 170 in a lot of different places, but we have about 400 physicians who commit suicide every year in this country. And so that is something that is very real, and that was before COVID. So most medical schools will go ahead and have psychiatrists on board. And the most effective ones have a situation where you have to opt out of being able to go ahead and have a chance to talk to somebody, because, you know, we're exposed, you know, if you've got children who are dying from COVID, if you have, you know, things that are happening around you, and then you have to continue and finish the rest of your day, you know, and see more patients and things like that, it definitely does have an impact. So definitely physician mental health is a priority because we need us. We need to be able to be available for our patients. And so we need to take care of ourselves as we take care of others.
That's heartbreaking to hear. And I think that we take a level of humanity away from the heroes, from the people who wear the capes that fight for us every day. We take that level of humanity. Just hearing you say that there are about 400 physicians a year who are committing suicide from the things that they're saying, and then also seeing those faces on TV begging us to go get vaccinated, pleading with us to go get vaccinated, that I can only imagine the pressure that is as a physician. And that should, for no other reason, make you want to say, well, let me at least go get vaccinated. They're risking their lives to take care of us. The least I can do is be considerate enough of the heroes who have been saving us and getting vaccinated. So I hope that you really hear what Dr. Edgy is saying as you are tuning in to this live tonight. Dr. Edgy, before we turn over to our amazing CEO of the Center for Closing the Health Gap, Renee Mahaffey-Harris, in closing, tell us, what are the things, do you have some last thoughts on what are the things we need to remember this summer as we begin to gather and we are back outside?
I would definitely make sure you've got a spare kit on you for testing. Get a kit, have a kit handy, have it in a bag, have it somewhere. Be thoughtful about the things you're doing, because life can change in an instant. Luckily, like I said, we do have treatments that are available right now. Paxlovid is one of them. It's a 5-day, 2 pills a day treatment for patients. There's some specifics to go ahead and get that given. It's not over the counter, it has to go through your doctor. We have additional vaccines that are coming out available to folks. We have access to a lot of different things, but I think one of the most important things is care about the people around you. And then you'll naturally do the things you need to do, including vaccinating your kids, vaccinating yourself, and keeping yourself healthy.
Dr. Edgy, you are amazing. We couldn't do this without you. We absolutely could not. Thank you so much for joining us. And thank you, Tasha Wilkinson, from skipping out of class and joining us as well on the Center for Closing the Health Gap's Town Hall on what we need to remember this summer. Now we are turning it over to Ms. Renee Mahaffey-Harris.
You're on mute, Renee.
You're on mute, Renee. Renee, you're muted. We can't hear you. Okay. Okay, we are having a little bit of technical difficulties. We will give Renee a moment to see before we log out at 7. But Dr. Edgy, thank you again.
Okay, I am so sorry.
There
I'm
you
having
go.
technical. Okay, so I'm frozen, but I'm hopefully you can hear me.
We can.
Okay. Well, first of all, I want to thank
There you
Dr. Edgy, and I want to thank Tropikana, and I want to thank Tasha for joining us as well, and all of those of you who are joining by Facebook as well as on Zoom. We are continuing the conversation because we must continue the conversation, because that's how we're going to continue to work to save us. And, you know, all of this is possible because of many partners, but in particular, the African American Chamber, the Urban League of Greater Cincinnati and Southwest Ohio, Cincinnati Medical Association, the both health departments, Hamilton County and Cincinnati Public Health. Test kits, you kept mentioning getting a test kit. We have test kits available at the Center for Closing the Health Gap. just call us at 513-585-9879 so that you can have a test kit readily available for you or a member of your family. I think, Dr. Edgy, as you talked about the impact on the healthcare workforce, which it has been a huge impact on the nursing workforce and the physician workforce. And so, you know, what we have to continue to do for each other is give each other grace and continue to remember that we are all in this time together, and do our best to, you know, protect ourselves and our families. And again, just remember to give one another grace. So I pray that everyone has a great summer. We'll see you back here right before the school year begins. And again, thank you, Dr. Edgy, thank you, Tropikana, and thank you all for continuing this conversation, because we need to remain informed. And so you guys have a great summer, and we'll see you back right before the school year begins. Thank you
for
all.
having me.
Thank you so much, Renee, for creating this for us. We appreciate you.
You
Bye, Dr.
know,
Edgy.
we all have done this together. Thank you.